This is a picture of the T1, T2 vertebrae.
Is this the blue area?
Yeah,
by the shoulders?
the blue area in the middle, that cold spot. Now, cold is an issue when we're talking about nerves. If you have a cold spot, then the nerves are not functioning properly. They could be entrapped, sort of squeezed off.
What's that red spot on the neck?
Well, she also has inflammation in the back of her neck, which could be tension, right? Severe tension that would need to be released. A good body worker could release that. So what's important about this shot and this cold spot here, the blue, especially in those two vertebrae, that's where the immune system innervates. So if you're cold there, you're going to have a weakened state in your immune system.
I know, TMJ.
Exactly. So here is a if you look at the white hot spots around the jaw joint by the ear, that's TMJ, temporomandibular joint dysfunction.
What I noticed also, look at her posture. Look how far forward her head is.
Yeah, the head is pushed forward.
You know, that's such a common missed factor when people have go for TMJ treatment. They have to look at their posture, their head position, and balance the head with the lower back and work the whole body. It's not just at that TMJ.
Yeah, and TMJ, the symptoms could be clicking of the jaw, right?
Limited opening.
Limited opening. You can't open your mouth very wide. Sore muscles.
Lots of pain.
And lots of pain. And headaches. Tension.
That's right.
So there's a good look at what thermography can do. I'd like to just give some thoughts on protocols and how an appointment works.
Okay.
One of the things you need to establish is it's called your thermal thumbprint, or your baseline. So when you come in for your first set of images, we do your shots. 3 months later, you come back and we retake the breaths, because we want to know what is normal for your body's physiology. And in those 3 months, you will get a report, and you'll be able to work on protocols that will help you get healthier. And it's really fun to see at that 3-month interval the shift and the health that comes about.
Do you have any specific case histories of patients with dental problems that you've seen recently?
Yeah, I do. I had a man come in for a men's health screening. He just walked into the clinic for a thermogram. A men's health screening goes from the top of the head to the pelvis. So we did his images, and I noticed right away that he had some redness showing through on his mouth. So I asked him.
You mean on the image?
On the image. So I asked him if he was feeling any pain in his mouth, if he had any symptoms. He said no, although his gums did bleed. So that's a symptom, bleeding gums. So I took him into the clinic. I did a little sample of his saliva, and we put it under the microscope, and we found a very bad infection that he didn't feel. He didn't know he had. The only indication was maybe bleeding when he flossed.
Right. And you know from our previous shows, if you have a bad infection in your gums, that can lead to a possible cause of heart problems or diabetes, if you're a woman, preterm birth. So it's important that you have these infections looked at, because down the road it will prevent possible diseases.
Right. I would like to go back to lymphatic drainage for a minute, because this is a big one. So our lymph system carries toxins and waste. If you're wearing a bra 12 hours a day, you're going to have congestion, right? You're going to have, your breasts will basically be bathed in toxic waste. So one thing you can do to empower yourself is to get a long-handled, natural bristle brush. It's like about this big. And it's called dry brushing the skin, because your lymph system rests just under the skin. So when you do this quick dry brush, it only takes a couple of minutes a day. You move the lymph, and you start to get the stagnation to flow out of your breast tissues. It's very important.
Right. That sounds great. Now, sometimes you see pictures of patients where it's all red under the armpits. Is there a good or bad or different types of deodorants that you would recommend patients use?
Well, Patients are red under the armpits for different reasons. In this picture, these are normal thermal patterns, but there is some redness under the armpit coming down the sides of the breast, and that can come from lymphatic congestion. And it's like you said, deodorants. You want to avoid deodorants that have the aluminum.
Okay, great.
Okay, because aluminum is not good for the body.
So, Tammy, going back to the case study you mentioned earlier, what treatment recommendations did you make for the patient?
Based on the gum infection, we did some deep scaling and root planing. We cleaned up his mouth, first of all.
Right, but when you clean the mouth up, what do? You just go in and you scale it? Would you irrigate it?
We do ozone irrigation.
And ozone does what?
Ozone kills bugs.
Okay.
Kills bugs. So we do some ozone irrigation. We do some deep scaling and root planing, which is a deep cleaning into the gums. And we did this more than once, right? He had a few treatments. And we got him on a home care regimen. We got rid of the floss, and we did the irrigation because that's better.
Right. Did he measure his pH to see if he was too acidic?
Well, here's the thing. We went back and got a report from his thermograms, because when I did the thermograms, I did from the head to the pelvis. So the reading doctor sent back a report, and he commented on the amount of inflammation and infection that he saw in the gut. So now we were able to put him on a program to clean up the gut. And when you're cleaning up your digestion, you are cleaning up your mouth. They go hand in hand.
And you're also addressing.
How do you clean up the digestion?
And you're also addressing the pH.
Exactly.
And you make it less acidic because the acid starts in the stomach.
Right. So he had to do a 3-month protocol because we had to rescan him. We cleaned up the digestion with some clays, some probiotics, some fiber, some digestive enzymes,
Right.
some HCl, and some exercises for the spine. And I'll tell you, we also did a shot of his spine. Your digestive system works a lot through the nervous system. And because his spine had so much tension and entrapment, we needed to free up the spine so that the digestive system would work better also. So we had to make some home exercises for his back.
Very good. So basically you're treating his mouth with all these nutrients.
Right.
And the benefit is it's helping his gut.
Exactly. And you have to ask yourself what came first, the inflammation in the mouth or the inflammation in the gut, because it's a circle. It goes
Right.
both ways. So we cleaned up both ends. And he did his thermograms 3 months later, and he looked great.
That's great.
Yeah, his gums are healthy, no more bleeding, no more bugs. He looked really good.
That's really wonderful. Yeah.
Absolutely. So when you get your report back from the reader, from our doctor, he will have a lot of protocols, and they're simple. There's supplements you can take, there's herbal remedies, there's homeopathic remedies. You may need to get some body work done to free up the tension and the muscles, the entrapments, or acupuncture.
Right. So let's say we have a patient and they're out there, they do their first month, they do their 3-month follow-up, and whatever was there is still there, or it was even picked up at the first month.
Yeah.
So how would you guide them? What would you suggest they do?
Well, the first thing they need to do is, first of all, if you do your thermograms and something comes back suspicious, that's a red flag, you would have an ultrasound done on that body part.
Right.
And an ultrasound is also no radiation.
Okay.
So it's a very safe technique, and it's very accurate.
Right. And we work with someone who does a 3-dimensional ultrasound, which is more accurate than a 2-dimensional because you can blow up the whole area and see it and see the blood flow and everything.
Right.
It's a great treatment.
And besides getting ultrasounds on the breast, you can get an ultrasound on any body part. And I've sent quite a few people to get ultrasounds done on their gallbladder. Yeah, because their thermals will come back, and it'll show intense heat patterns right around the gallbladder, and the doctor will recommend ultrasound on gallbladder,
That's
to
great.
follow through.
Good.
Absolutely.
Well, you're definitely making a difference with something that people seem to love to do.
Yes, It's safe, it's effective, and it's easy. The worst part of getting a thermogram is that you have to sit in an air-conditioned, cooled room for like 15 minutes. And when you get cool, that renders a response of your sympathetic nervous system. And that's when your heat patterns come out. And then we take your pictures, and that's how they find out what's going on with your physiology.
So how long does the whole process take?
Anywhere from a half an hour to 15 minutes. Depends on how many pictures you want to get done.
Mm-hmm. And I assume they have to prep beforehand.
Yes.
Right.
That's huge. You need some quality control for your thermograms. So for a patient prep, before your appointment, there's no showering, no shaving, no lotions, no creams, no deodorants, no oils, no sunbathing, no smoking, no caffeine. It's quite a lengthy list of...
I'm surprised you have patients coming here.
Yeah. But it's all, it's all part of getting the accurate reading, because all of those things change your body's temperature.
So I guess also, so no sun tanning boots.
Oh no, not the day of your thermal.
No body work.
Nothing.
Nothing. Just roll out of bed and come here.
Yeah, eat a little bit. There's certain medications you have to avoid, like painkillers. Anything that's going to change your nervous system.
I see patients coming here at 4 o'clock in the afternoon. I wonder what they're doing all day.
Right.
Maybe they're sleeping.
Maybe. Just a note on thermography's history. It actually was developed in the 1800s. And even before that, the Egyptians used to rub mud on the patient's organs. Wherever the mud dried first, that was where the disease was. So heat and body health has been around since the beginning of time.
Wow. Let's give the viewers the website that you use.
Great.
Tell them quickly about, we only have like a minute left, about the free chapter of the book they can get on the website. So
our website is www.thermographyforhealthnewyork.com. That's thermographyforhealthnewyork.com. There is a book on there from Dr. Ben Johnson. It's called Breast Wisdom, and you can download a free chapter.
Great.
Check it out.
And you can always find us at Dentistry for Health, New York. We're at 120 East 56th Street. Our phone number is 212-973-9425. And the website, I have a new short website for you, www.D for David, F for Frank, H for Henry, N for Nancy, Y for Yellow.com. Have a great night. I'm Dr. Reed Winnick.
Thank you. I'm Tammy Colchman, and
have a great one.
See you next week.